Hi, my name is Dr. Anubha Sinha. I'm board certified gastroenterologist and hepatologist. I'm also founder and president of Digestive Health Specialist. I have additional fellowship training for motility disorder of GI tract from ANMS, also known as American Neuromotility Society from Temple University, Philadelphia. So today we are going to talk about hemorrhoids. I'm a female gastroenterologist and practicing for over 20 years. Hemorrhoids are very common. We are all born with hemorrhoids. These are cushion of your anorectal canal. But at times, or many times I would say, that can cause triggers such as pregnancy, obesity, constipation, can become symptomatic, such as rectal bulge, bleeding, itching, all of that. So now you don't have to suffer anymore. During the consultation process, we just want to make sure that we have excluded much more serious causes, such as colorectal cancer, Crohn's disease, fissure, abscess. We just don't want to presume that you have symptoms are due to hemorrhoids and treat it empirically. We want to make sure everything else is excluded. So first we do, after taking a good history, I will do a good skin assessment around the rectum area. So you'll be laying down in this bed. We will incline it and you will be facing on the other side. You will be watching at the window. I'll be on this side and I will do a good rectal exam, and we will look for fissures, abscess, fistula. I have diagnosed psoriasis, skin infection, folliculitis, everything. In that scenario, you don't need your hemorrhoids to be treated. You just need some perirectal hygiene, some local medication, and you'll be done. After the visual examination, I will be using anoscope. There are two kinds of anoscope. This is lighted anoscope, and it's a light, very fancy one, and it goes inside the rectum. This is no different than what the GYN gynecologist uses a speculum to examine. This is an anoscope. It gets lubricated and it gets inserted right into your rectum, and then I am able to visualize your hemorrhoids. And I will say this are external hemorrhoids, internal hemorrhoids, because we need to differentiate that. Management is completely different. Most of the external hemorrhoids are managed medically, and they go away, sitz baths, ointment, avoiding constipation. But if the hemorrhoids are internal, meaning inside, above the dentate line, we can do rubber banding, we can do IRC. So these are very important steps to rule out other causes and before we start treating internal hemorrhoids. So we'll talk about banding first, which is very popular. So here we use three kinds of band: CRH Medical, Adler, Micromed, and Snyder. Basically, the design is pretty similar, very slim, but designs very similar. They do the same purpose, but they're different preferences, and I use them all. I love them all. It's a very simple, gentle procedure. It comes like that. It comes with a very nice post-treatment instruction kit that you can go over when you go home. Bottom line, you don't have to take Advil or leave Motrin for about a week or two and don't do any heavy lifting or extenuous exercise to do 3 days. That's what is very simple instruction. So we attach this here. We attach this to here. We thread these bands. These are very tiny, small little band. I don't know whether you can see or not. It's a very tiny, small band here. I can actually take it out from the packet, and you will see these are latex band, but we also have the blue one, which are non-latex. So these are very tiny, small rubber bands that's attached to the tip right here. We thread it and we attach it right at the tip. So now we threaded it and the band is attached, and we are going to insert that right here in the patient's rectum. The patient will be laying down on this table and facing towards the window, and I will simply place the syringe right here, suction some of the tissue above the internal hemorrhoid and deploy it. So the band gets deployed right here above the internal hemorrhoids. the band is deployed above the internal hemorrhoid where you don't have any pain fiber, so you won't feel any pain, and this band will fall off on its own in about 24 to 48 hours. Most of the time people don't even see that, and you're fine. We will treat your internal hemorrhoids, and in 2 weeks later you come back again, because majority of us have 3 hemorrhoidal chains, so we will take care of it one by one, 2 weeks apart. Though it could be taken care of it all at once, but for comfort reason it's advised to do it separately 2 weeks apart. No pain, it takes about a minute to do it. You can drive on your own, no sedation is required, you can go back to your work the same day. Very easy procedure and is covered by majority of the insurance. Let's talk about IRC, infrared cauterization. We use this a lot for outpatient treatment of internal hemorrhoids. This is an IRC device, and you can see we can adjust the cauterization here. This is a very nice probe, and it is all in my practice. It's disposable, so disposable sheet goes into here. We just insert this, and here it is. It's all ready, and it's ready to fire. You can see the light comes in, it's ready to fire. We can adjust the cautery level 1.3, 1.4 depending upon the size and of the internal hemorrhoid. And this is ready to go, and patient will be sleeping here with the left lateral side left facing towards that wall. Your bottom is going to be facing me, and you're not sedated, you don't need any prep. All the treatment would be done above the pain fiber, so you won't feel any pain. You don't need any bowel prep, so you'll be facing. I will place that into the rectum right here. This is your rectum, this is your anal canal. This blue thing is your internal hemorrhoid. It will go right here, and I will go above the dentate line, above the internal hemorrhoid, which is this purple, and I will cauterize that. It's done. I move at a 360 degrees around. I will cauterize that. I will look at how much heat is needed to cut down the blood supply to the internal hemorrhoid. I will adjust my heat right from here, adjust it. It is a visual, so you want to make sure you're not doing too little of an energy, so blood supply is not destroyed, and not too much that you cause complication like ulcers or bleeding. So you do it all 360 degrees. All the hemorrhoids could be cauterized at the same visit. It takes less than 5 minutes. Numbing is generally not required. You can go on to day-to-day activity the same day. We just ask you not to take Advil, Aleve, or Motrin that day, and not to do heavy lifting for 24 hours, and you're done. Covered by majority of the insurance. And again, it's painless procedure because pain fiber is not here when we're doing the cautery. There is no pain fiber, so we go above and do it. How long I have been doing it for? 15 years, maybe more, I don't even know. How many I have done, I don't know. I'm going to be demonstrating now is that another form of banding of your internal hemorrhoid, but this is different because it's called endoscopic band ligation, meaning it is done at the hospital or at the surgery center, and this band is attached to the scope at the end of the scope. So let's say you're having a colonoscopy, a sigmoidoscopy, and you wanted to get a banding done at the hospital or the surgical center. At the same time, towards the end of the colonoscopy and sigmoidoscopy is very easy, very friendly. You can do it under sedation. Or second scenario, that you don't want to get it at the outpatient, you're nervous about it, so we can do it under the sedation. So this is a scope, assume, and this has a light in it. We attach this bander right here at the tip of my colonoscope or sigmoidoscope. Can you see it has band? These are yellow bands. These are yellow bands. 1, 2, 3, 4. We usually have 3 hemorrhoids, so we don't need all of this, but sometimes we have additional extra if we need it. Let's say one band slip, or we need extra one, okay? So this is this, and you're sedated, you're comfortable, you had the laxative done, bowel prep done, you came to the hospital or the surgical center, examined by anesthesiologist, you're sleeping, colonoscopy is done, and now I will take the scope, attach this, go through the rectum, going through the canal, going through the internal hemorrhoids, go above it, suction the tissue above the internal hemorrhoid, grab the tissue, and then deploy one of these rubber bands, and I can simply fire the rubber band. I turn it off, and the rubber band literally comes out of that. And rubber band is deployed. This is the knob, and first rubber band is deployed. I can move my scope, and then I can deploy the second and a third by the control here. I take the simple colonoscope, which has a tip, it has a bander, I remove it. You're done. You wake up, you need a driver to take you home because you will be sedated, and it's one and done. The next demonstration that I'm going to do is HET, also known as hemorrhoidal energy therapy. It could be done in outpatient facility as well, in our outpatient hemorrhoidal center, but it could also be done in the hospital. It could be done in a combination of a colonoscopy or sigmoidoscopy. It's very easy, so let's talk about it. This is a fancy anoscope, unlike before. It has two parts. One is the anoscope part, where it will slide into the rectum and anal canal. And this is the handle. The handle has a light here, and this is the anoscope. If you turn around, you will see this has a large slit here, and when I press on it, slit gets closer, smaller and smaller. So the purpose of this slit is to grab the hemorrhoidal tissue, and close the slit, so we can grab it and it's secured before we do the treatment. Cord is attached to an energy device, and I can see how much energy is generated, and we need to cauterize, so we try to keep around 45 to 55 degrees Celsius. So this is lubricated. Again, this is lubricated. We lubricate the anoscope, and this you're laying and you're sedated. We pass it right from your anus inside here, and you see the slit, this little tissue here is your hemorrhoids. Above the hemorrhoid that is going into the slit, we are securing that tissue, and then energy is delivered. This is treated. Let me show you in this way. Assume this is your hemorrhoids here in the bottom, and this is the tissue above the hemorrhoid. This is a Q-tip. So assume the stick of is the hemorrhoid, and above this cotton is above the hemorrhoid. So we just simply slide it, grab this right here, close the slit. Is right, the tissue above the hemorrhoid is secured very nicely. I'm holding it up, and then I press my foot panel. This is attached to the energy unit, and I deliver 45 to 55 degrees Celsius, and you will see the tissue effect. And the purpose of it is to cut the blood supply off of the hemorrhoids. So hemorrhoids shrinks, falls, and it's done. Then after one hemorrhoid is done, we just move and rotate this and take care of the second hemorrhoidal chain exactly the same way. And then we have 3 hemorrhoids, so we're going to rotate and do 3 hemorrhoids, the third one. Occasionally it requires some of the hemorrhoids, stronger one, they require more than one cautery, so we can go up to 5 times cauterizing, 3 to 5 times depending upon the patient's needs. You take it off, you wake up. In the recovery area, you will have given recovery is exactly how you would recover after any endoscopic procedure. 10 minutes, you wake up from sedation, you will have some coffee, tea, snacks, you're feeling good, you're getting a discharge instruction that take stool softener, do not take Advil or levomorphin because we don't want that cauterized tissue to bleed, and you should be having no pain, maybe minimum discomfort, and you're ready to go home. So hopefully you enjoyed all of these demonstrations and you can see how simple outpatient or non-surgical hemorrhoidal treatments are. Hemorrhoids are very common, we all have it. Majority of the time it becomes symptomatic. Please don't hesitate to call us if you have any question, concern. Call us, we will guide you step of the way. We'll do the consult and then we'll decide together which hemorrhoidal non-surgical treatment option is best for you. And then we will go from there.